Thank you very much for the opportunity to present today. My name is Stanley Okoro. I'm right here in Atlanta, Georgia. As many of you on this panel, um, I've seen BBL numbers kind of gone down a little bit over the last year or two. That does not mean that BBL is still not being performed, but in our practice, we started to see a trend in people not getting BBL and doing more BBL reversal. So we started looking at this, and I started asking myself, we've all done this big butt in probably 5-10 years ago, and I was asking myself, was this ever attractive? People looking abnormally enhanced in the backside. And then the more I look into it, I start looking at this person and say, oh, wow, she's really gone through the whole range of small, normal, big, and then reversing her trends. And as the aesthetic trends continue to change, especially social media influencers, and what's happened is those people that were responsible for the big butts have really also responsible for the change in the influence. Social media affects all of our social lives, as you probably know. So I started asking my question. The question is the BBL era over? Is the pendulum swinging? Because in my practice now, I do more BBL reversals than I do BBLs. And people are coming from all over the world to get this stuff done. As you know, patients will travel anywhere in the world to get what they want if they feel like that you are the best person for them. So because of that, we started looking at our own patients. We have been doing this since 2018. We looked at all of our patients that have requested BBL in our practice from February 2018 to December of last year. Actually, the interesting thing is we've done more than we've done last year at the same time. This is in a single center, Quade Self Surgery Center. We looked at outcomes and complications. These are all my patients. There were 123 patients that were done. Majority of them, of course, are female. The age range between 20 and 59 years old. Operative time varies because some of these patients had other things to work that were going to combine with their BBL reversal. The complication rate is about 1% because there was no padding. Majority of the patients, the procedures were performed under local anesthesia, what we call oral sedation. Oral sedation is when we give them some kind of anxiolytics, something like Xanax and some narcotic medicine to get them relaxed. And about 37% of the patient had it done that general anesthesia. It could be maybe they're combining with other procedures, or they just didn't want to deal with local anesthesia, or they have a lot more scar tissue. These were all done prior to their surgery. 90% of the patients that had a BBL reversal, we used energy-based devices to deal with, of course, the skin. There's two problems. One, you have the excess fat. Many of them had a fat growth during the pandemic. They all added weight. So there's an increase the growth in the fat. And then you have the skin. So when you do an extensive reduction, you also have to have a way to address the skin. When we started doing this, we had a tummy tight. We've used the smart lipo laser, smart lipo machine, and recently we used RF device with body type and Morpheus to address the skin. So those are the breakdown of those patients. About some of them, about 10 to 15% of the patients had no energy-based device at all. This is this is just an example of the procedure. As you can see, this patient is undergoing liposuction of the buttock, and now we're using this is a body tight machine to tighten up the skin, both on the inside. So we do the body tight inside, and we do Morpheus micro needling on top of it to help um, um, tighten the skin. This is normally done after the liposuction is done. How much fat do we remove? The average is about 700 to 800 cc's of fat in some patients up to 2,000 liters of fat from each buttock cheek. So it all depends on the amount of the size of the patient. Some people are huge and some people are small, and then they wanted to just get it reduced to fit their regular size or weight. And some of them want to go back to their original size, which sometimes may not be possible. And if it's hopefully nobody's doing intramuscular fat injection anymore, but some of those people prior to the switch from intramuscular to subcutaneous fat injections. So those kind of patients, there was minimal fat reduction from the subcutaneous area. If they have intramuscular fat, it's very little that we can do. So sometimes I attempt to reduce those things if it's more lateral, but if it's more central, I do not go into the muscle. But laterally, we can, and we have. Let's see. All right. In terms of the amount of tumescent that was used during this procedure, it's about 1 liter per buttock cheek, but the bigger the buttock is, the more I have used up 2 or 3 liters per buttock cheek, depending on the size of the patient. But this is like the average amount. So about 2 liters for every patient. If it's being done under local anesthesia, so you start to worry about the lidocaine that you're going to use. If they're big, I prefer general anesthesia, so I would reduce the amount of lidocaine that's used. If they're small, it can be done that local anesthesia. So those are some of the factors that you want to consider as you're doing this. In terms of complications and complaints, we had no skin necrosis with the energy-based device that we used. There was no infections. All patients received antibiotics before surgery and during surgery if the procedures last more than 3 hours, but nobody had post-operative antibiotics to go home with. There were no seromas. There was no hematoma. About 10% of our patients reported residual fat. About 6 patients had complaints of skin laxity, and about the same amount was reported a residual or new asymmetry. So those are the things that we had, as you see on the photo. 75% of our patients had no complaints, so which is pretty good. But these patients are very picky. They are almost like the new rhinoplasty patients. They're never happy to start with. So a patient realistic expectation is very needed. You have to deal with all of this stuff, but fat and skin laxity and asymmetry. Try point this out before surgery, or it will become your problem. These are the breakdown of the surgical cases by quarter. I'm going to show you some representative photos of what we've done. This is not meant to be a before and after show, but just kind of give you one of the challenges that we've had for CCO patient. Most of the patients I'm showing here all had the RF devices and laser, and some did not have any. So this is the typical result about 6 months. So we have follow-up from 2 years to 3 months. There's nobody here is less than 3 months. The patient here, this is one of the patients I removed 2 liters from each buttock cheek. And sometimes the pictures doesn't do justice to these patients. So the patient, 6 months afterwards, this patient did complain about a little bit of residual skin here, but if you notice in preoperatively, it's already there, but they don't remember how they look like. So it's always good to show the before and after photos. So another patient, same thing. We have to block the tattoos. This patient came from another, I think, Florida. She had multiple skin necrosis in her original BBL, and she had another BBL reduction somewhere else. She came to me. Well, we were able to do this and added like PRP injections and some other microfat grafting to kind of help heal. And she ended up doing additional procedures with us. Some people have just excessive skin and hips. This patient had excess. It just looks so unnatural in the clothing. She was happy with her butt, but her hips were too exaggerated, and she just wanted normal, normal contours. This is another patient. This is a very new deformity where people put so much fat in the lower part of the buttock. It almost look like a diaper butt. So it's like we started calling it a diaper butt deformity. And until now, I mean, you could remove the fat, but you're going to have a lot of loose skin. It's very important to use energy-based device of your choice that will tighten skin to shrink this. And this is 1 year afterwards. And what we found is if we actually go back, you can do this again, and you will get a much better skin contraction. This is another example of that, but this is less obvious, but you can see right there on the lower part of the buttock. It's like a buttock ptosis, but this is from fat transfer. This is this patient is done already, but she came back for this, and that's what we did for her, just to tighten that up a little bit. And then we added a little bit of fat to kind of balance her out. Of course, you've seen the hip blowouts from the excessive fat injection in the hips in subcutaneous area, and shelf. So we've seen all kinds of patients in this situation. Let me see. So in conclusion, BBL reversals and increasing body content procedure in plastic surgery. It can be safely performed as an outpatient procedure when the right surgeon who has the right training. We predict a significant rise in these procedures as the patients continue to gain weight and get older. There is a low rate of complications. It's a high level of patient satisfaction. However, there's a lot of hand-holding that goes along with this. I'm happy to take any questions from anyone, and this is how to contact me. If you want to contact me, this is how to reach me. I'm happy to take any questions at this point. Thank you very much for the opportunity to share my work.